Hi, Dr. Tim Clare with Pro Health and Wellness in South Charlotte Disc Center in Charlotte, North Carolina. Was going to show you today a little bit more about how to strengthen your legs, how to strengthen your back using an exercise that we utilize all the time called wall slides. Now, if you like this video or if you like the information we give you, please click subscribe or let other people know. Follow us what we have so that we can get you more information and more videos, and we know that you actually like the content that we're giving you. So wall slide, one of the important parts of doing a wall slide, like I said, to try to strengthen your quads, help your back, is to get away from the wall. If you notice, my legs are out away, my feet are away from the wall, and I want to make sure that happens because I don't want my knees to go in front of my toes. If that happens, I'll actually create more problems with my knees. It can become more detrimental to my overall health. So I want to keep my legs kind of back. I want to keep my legs tight here. I don't want to have them locked in, and I want my back flat up against the wall. The slide is down the wall, and I'm going to go to a maximum bend of about 90 degrees. So I want my legs to be parallel with the floor, and then I'm going to push my body back up. And I'm going to go to that position before locking the knees out, just before it. Now, I'm just going to show you how it shouldn't look. This is what you don't do. I'll repeat that. Do not do this. If I'm too close to the wall, when I go to slide, you're going to notice that my knees immediately go in front of my toes. I'll show you from the side. If I do it from this way, you'll see that if I'm away from the wall and I go down, my knees stay behind my feet. But if I go too close to the wall, I'm now going down and my knees are going in front of my toes. That's a problem. I can damage my knees doing that, and all that work I'm doing to try to strengthen my back and my legs for naught. So again, I'm going to show you how to do it properly. Feet about shoulder width apart, knees slightly bent, back up against the wall, head looking straight forward, and I'm just going to slide down till I go neutral, parallel with the floor, and then I'm going to push my body back up. Some people like to go down, hold it for a couple seconds, and go up. That's fine. Now, I have patients who can't go that far. So what do? You go to the point where you start feeling some discomfort and stop. If that's as far as I go, that's as far as I go. And I start working at that. What you'll find is over time, you'll be able to go deeper and deeper to where you can do the full wall slide. Now, on a flat wall, perfect, but you may find one of my favorite things is like in a door frame. Going down a door frame, because it's painted a little differently, you got a little more slick surface, it's easier. Even better, when you get this down and you're comfortable with it, you can take an exercise ball. With an exercise ball, I'll put it behind me like that. I'll lean again, and I'll perform the same slide down the wall. Remember, feet out in front. You may not see it here, but feet are out in front. I'm leaning into the ball, and I'm just rotating down and coming back up. Okay? So the ball gives another additional component. I'll do it this way so you can see it a little better. Like this, again, leaning my body back into the wall, into the ball, and I can slide down and come up. It's a little easier than the friction created with a wall. Plus, you don't mess up your walls so much. So, wall slides, do them. How many do you do? Well, you can start off with sets of 6. Do 2 sets of 6, see how you feel. Work your way up. Again, I always recommend, if there's a question on this, talk to your physician, make sure that they're comfortable with you doing it. But this is a great way to really start strengthening your legs, which is going to help your back. So remember, it's your future. Be there healthy.